Most doctors are aware of the side effects of individual medications, but very few truly understand the dangers of taking multiple drugs simultaneously. The interactions between certain medications can be significant. Today, let's discuss some commonly prescribed drugs that can contribute to dementia, or at the very least, dramatically increase the risk. From my perspective, experiencing side effects from a medication is already concerning, but developing dementia due to a prescription drug would be devastating. So, let's go over the most common medications linked to an increased risk of dementia. Medications that can lead to dementia. The first category includes drugs that block or inhibit acetylcholine, crucial neurotransmitter in the brain. These include Benadryl and antihistamine, certain antidepressants, and medications used to treat an overactive bladder. If taken over a prolonged period, these drugs significantly elevate the risk of developing dementia. Next, we have benzodiazepines, which are commonly prescribed for anxiety, insomnia, and seizures. Medications such as Valium and Xanax directly impact the central nervous system, your brain, and greatly increase the likelihood of developing dementia. Another concerning category is proton pump inhibitors (PPIs), which are used to treat indigestion and acid reflux. Common examples include Prilosec and Nexium. Long-term use of these medications has been linked to cognitive decline. Finally, the most alarming category is opioids, including morphine, oxycodone, and other pain relievers. Any drug that sedates the brain, including anesthetics used during surgery, can severely impact cognitive function and heighten the risk of dementia. The hidden danger of drug interaction Sumfitari. As people age and enter assisted living or nursing homes, they often receive medications routinely, sometimes without thorough oversight. To understand the real impact, let's hear from someone who owns multiple assisted living facilities. Many of our residents arrive with 20 to 30 medications each. Our record? One individual was on 54 different prescriptions when they arrived. This facility takes a unique approach, introducing real food as part of its therapy. The owner explains, "It's simple. We provide real, whole foods, unlike most nursing homes that rely on ultra-processed meals due to budgeting and contracts with major food distributors. Family approval is necessary, but they follow a strict protocol for nutrition. The goal? To eliminate harmful processed foods. We avoid packaged foods, refined sugars, and artificial ingredients. A health coach trains our staff to recognize hidden sugars. There are over 65 different names for sugar on food labels. We focus on single ingredient foods like fresh vegetables, quality meats, and whole grains. Can patients reduce medications? The results speak for themselves. Many residents are able to reduce or eliminate medications over time. We frequently work with doctors to decrease medication dependency. We've successfully helped diabetics get off insulin, reduced reliance on blood pressure medications, and discontinued statins when appropriate. They even had a patient on 54 medications who, after care and dietary changes, now lives independently on just 20 prescriptions. Recovering from hospice care. Many individuals arrive at the facility already in hospice care, but the team works diligently to improve their health. We call it graduating from hospice, meaning patients improve to the point where they no longer qualify for end-of-life care. The physical transformations are remarkable. Some arrive bedridden, transition to wheelchairs, then to walkers, and eventually regain their ability to walk independently. One resident, 98 years old, was able to go on a week-long cruise with his family, something he never thought possible. He returned home, lived happily for another 6 months, and passed away peacefully. The need for change. If I ever know someone in need of this level of care, I will definitely refer them to a place like this. I'll also include a link below for those interested in learning more. We need more organizations adopting these practices. The complexity of over-medication. It's difficult to pinpoint the cause of specific side effects when a patient is taking multiple medications. Adding to the complexity, different doctors manage different parts of the body, each with their own approach and focus. A major concern is adverse drug reactions (ADRs), unexpected side effects caused by medication. Alarmingly, 90% of these cases go unreported. ADRs account for 10% of all hospital visits and are the fourth leading cause of death. To dive deeper into this issue, I invited a board-certified endocrinologist to share her insights. We know drugs have side effects, but the interactions between multiple medications are not always well studied. Patients receive small package inserts filled with tiny, unreadable text. Most of us don't read them. In countries like India, many medications come in simple blister packs, without any warning labels. This lack of transparency leaves patients vulnerable to serious health risks. Final thoughts: understanding the effects of medications individually and in combination is crucial for long-term health. If you or a loved one are on multiple prescriptions, it's essential to ask questions, seek second opinions, and explore alternative approaches like proper nutrition. What do you think? Have you or someone you know experienced unexpected side effects from medications? Let's continue this conversation in the comments below. And if you found this information valuable, don't forget to like, share, and subscribe for more content like this. Patients often don't have a comprehensive list of potential side effects to review, and drug interactions are typically buried in tiny print. Busy doctors prescribe medications without always considering how they interact. To stay informed, I use a free software tool called Epicrates, which helps identify drug interactions. With the constant influx of new medications, it's essential to stay on top of these risks. Even during my time in practice, I had patients who were on 5, 10, 15, or even 20 different medications. Have you noticed how the number of prescriptions has skyrocketed? It's especially prevalent among patients with chronic conditions, unlike short-term cases where medications are prescribed for a week or less to treat a fever, back sprain, or infection. For conditions like high blood pressure or diabetes, medications often become long-term solutions without a structured plan to taper off. This is why I focus on regularly reassessing medication lists to eliminate unnecessary prescriptions whenever possible. Often, patients see multiple specialists, each focusing only on their specific area without considering how their prescribed drugs interact with others. As an endocrinologist, I technically count as a specialist, but I often take a big picture approach, much like a primary care physician, by reviewing all prescribed medications. It's shocking how frequently we find duplicate side effects. For example, 2 different medications that both cause constipation or drowsiness. Even in my personal life, I witnessed this with my mother-in-law, who began showing signs of Alzheimer's as she aged. Upon reviewing her medications, I noticed she was taking a bladder medication known to cause dementia as a side effect. I spoke with her doctor, and once we discontinued it, she began improving. These cases are all too common. Another issue arises when patients take pain medications, which can sometimes lead to rebound pain. Similarly, antidepressants may cause a temporary increase in negative thoughts for some individuals. This cycle can be difficult to break without proper oversight. One aspect I truly admire about your approach is your emphasis on diet as a critical factor in patient evaluations. I recently heard a joke about pet owners visiting a vet. The first question the vet asks is, "What are you feeding your pet?" That's an obvious and essential question, yet human doctors rarely ask the same about their patients. It's fascinating. If nutrition is so critical for pets, why wouldn't it be even more important for humans? I firmly believe that what we put into our bodies has the greatest impact on either our health or our disease risk. When working with patients over 3 to 6 months, I guide them through what I call the 4 wheels of the lifestyle car. The first and most crucial wheel is nutrition. It's essential to examine everything that enters the body, including medications. If our goal is to reduce medications, we also need to analyze daily dietary habits. From there, we move on to sleep, followed by other critical lifestyle factors. The next component of stress management involves exercise, followed by fasting. But no matter what, The first and most critical wheel is always nutrition. Now, let's talk about some common symptoms directly caused by medications. Take constipation, for example. Did you know that constipation is a side effect of over 150 different medications? Chronic constipation can lead to a severe condition called megacolon, where the colon becomes enlarged, leading to infections, and in extreme cases, it can even rupture. That's why laxatives are often prescribed. However, the problem with laxatives is that they damage the colon lining and can be incredibly difficult to stop using. The body becomes dependent on them. Another example is diabetes medication, which works by removing excess sugar from the blood to help regulate blood sugar levels. But here's the real question: where does that sugar go? It's pushed through the kidneys and expelled via urine. This can lead to urinary retention, which increases the risk of urinary tract infections (UTIs). So, patients are then prescribed yet another medication to manage urinary retention, creating a cycle of more drugs to address side effects caused by previous ones. Another common side effect of multiple medications is dizziness. This is especially dangerous for the elderly, as dizziness is the #1 cause of falls in older adults. Dizziness is often triggered by high blood pressure medications, antidepressants, and sleeping pills. Then, there's something known as paradoxical drug side effects, a situation where the very medication meant to treat a condition ends up causing the same condition. This happens more often than you might think. For example, an antidepressant might actually cause increased depression, or an antacid might lead to worsen heartburn instead of relieving it. From my perspective, one of the biggest drivers of chronic disease is what people eat. The primary culprit: processed foods. Junk food sits at the very top of the list of reasons why people develop chronic illnesses and seek medical treatment. A significant portion of Big Pharma's medications is designed not to cure illnesses, but to treat side effects caused by a poor diet. Since most doctors don't evaluate a patient's diet, they miss the critical link between junk food and chronic disease. This omission fuels the cycle. Patients are put on medications, which then cause new side effects, leading to even more prescriptions. So, what's the one simple solution that can break this cycle? Swapping out junk food for real food. This one small shift can transform health outcomes and reduce dependence on medications. If you want more information on what real food is and how it can improve your health, check out this video right here.